New on to a ray of hope. In the midst of this devastating year for West Nile virus, 3 people have died and at least 61 injured so far this year. Researchers in Oklahoma say early tests for a vaccine against the West Nile virus looks promising. Adam Mertz reports from Oklahoma City.
At the OU Health Sciences Center, researchers are making progress as they develop a vaccination that could save lives.
They're very promising, so we think that we have a good candidate vaccine.
Dr. James Papin and other OU researchers are able to isolate strains of the West Nile virus. They then use a chemical which inactivates it, basically rendering the virus harmless.
We know that we can do it, and we know through lab models that it can actually, looks like it can protect against infection.
It looks very promising, and obviously it could be very beneficial if it were developed.
Dr. Robert Floyd with the Oklahoma Medical Research Foundation originally developed the technique now being used to find a vaccine. The researchers use a wavelength of light and the chemical methylene blue. Dr. Floyd used this same combination when he conducted AIDS research in the 1990s.
The way that this drug interacts with the virus and in the presence of light, it kills the virus.
Researchers are now in the process of developing the actual vaccine, which would then be followed by years of testing before it ever hit the market. Of course, funding is always an issue, but with the recent spike in West Nile cases, OU is hoping the development of this vaccination will be a top priority.
Now that we see this pattern emerging, there's going to be more interest in developing a vaccine in order to keep the disease out of the human population.
Now, another West Nile vaccine is already going through clinical trials. Researchers at OU hope to develop one that is just as effective and cheaper to produce.